Welcome to another episode of Absolute Talks. I'm Jack and this is Conrad, and today we'll be discussing screw-retained implant solutions for the 21st century.
That's right, I am Conrad and this is Jack. And the importance of restoring with an aesthetic yet retrievable screw-retained option cannot be overstated.
Yeah, very true. We've discussed full arch hybrid solutions multiple times on Absolute Talks, but single units still make up a large percentage of what we do at Absolute today.
That's right, Jack. There are multiple technologies on the market today, but we will look at a case study with Dr. Chris Barwich, a friend of ours from Iowa University, to explain this process a little bit more in depth. We process a lot of these smaller but yet challenging cases with Atlantis custom base, and then we use ASSA, angulated screw access, to correct for the screw access position.
This case is simple number 9, but as you know, these can easily go wrong. We started this case with a diagnostic wax up to help guide the emergence.
That's right. I believe the most important part of restoring with these custom base abutments is the fact that we can control that emergence profile to height of contour.
Right.
Where with the stock titanium abutment, sometimes we have to overbulk with zirconia, and it makes it very tough to emerge. So height of contour is not just important for aesthetics, but also to control the tissue and hold that tissue cuff.
Right, well what about a case where the screw access breaches the labial surface?
That used to be our biggest concern. It's no longer an issue. We have some technologies like ASSA, angulated screw access, that helps us to restore and control the screw access by up to 30 degrees.
Oh, that's great. So effectively gives us a screw-retained solution, correct?
Believe it or not, I actually classify this as a screw-mentable, not a screw-retained.
What is the difference?
Screw-retained was traditionally designed by layering ceramics on a casted UCLA abutment. We delivered it as one piece. The problem was it was a lot of hand processes.
Right.
Casting, layering ceramics, and it's not just expensive, but also weaker.
Right.
When we use a custom base, it gives us the ability to use a monolithic zirconia, which we know as exceptional materials, and we can deliver the case either as one unit, or as two pieces.
Okay. So what's the advantage of delivering it in two pieces?
When we process more complex cases, like this one with Dr. Mark Scuria, where we have multiple units, it allows the clinician to deliver the case in a more traditional crown and bridge way, remove it from the mouth, do all your adjustments extraorally, cement everything in the mouth, and then take it out, clean it up, and deliver it back.
So you believe delivering a two-piece is more efficient than delivering one?
I think in some cases where we have multiple units or interproximal contacts are closing in, it's easier to deliver the case as an abutment with a positioning jig, process all your adjustments intraorally, cement, remove, clean up, and replace.
Right.
We are very excited to restore your next case with you.
Stay safe
and stay healthy.